How does a bone cancer biopsy get diagnosed? Imagine trying to solve a mystery inside the body. To find out if a suspicious bone lesion is cancer, doctors need a piece of tissue to look at closely. This process starts with imaging tests like X-rays, CT scans, MRI, bone scans, or PET scans. These images help locate the exact spot of the abnormality and show how big it is and how it affects surrounding tissues. For example, MRI gives detailed pictures of the lesion and nearby structures, while CT scans reveal how much bone has been destroyed. Bone scans and PET scans can also show if the tumor is active and if it has spread to other bones or organs. Once the doctors identify the best place to sample, they usually perform a needle biopsy. This is a minimally invasive procedure guided by imaging technology like CT or fluoroscopy. The patient lies comfortably while the doctor cleans and numbs the area with local anesthesia. A small cut is made on the skin, and a hollow needle is inserted through the skin into the bone lesion under imaging guidance. Inside that needle, a second, thinner needle collects a core sample of the bone tissue. This process typically takes about 30 to 60 minutes and is often done as an outpatient, meaning the patient can go home the same day. In some cases, if a larger sample is needed or the lesion is difficult to access, an open biopsy might be performed. This involves making a small surgical incision to remove a bigger piece of tissue from the bone. The tissue sample is then sent to a pathology lab where specialists examine it under a microscope. They look for cancer cells and determine the specific type of bone cancer, which is essential for planning treatment. Sometimes, additional tests like molecular or genetic studies are done on the sample to get more detailed information about the tumor. If the doctor suspects the cancer has spread to the bone marrow, they might also perform a bone marrow biopsy. This involves taking a small sample of marrow from the back of the hip bone using a needle. It helps diagnose cancers like leukemia or lymphoma or cancers that have spread to the marrow. Before the biopsy, the healthcare team reviews your medical history, medications, allergies, and any bleeding issues to reduce risks. After the procedure, the site is monitored for complications such as bleeding or infection. Usually, patients are observed for a few hours before going home. In summary, diagnosing bone cancer with a biopsy involves first using imaging tests to locate and understand the lesion. Then, a needle or open biopsy is performed under imaging guidance to collect tissue. The sample is examined by specialists to confirm if cancer is present and to identify its type. Additional tests may be done to help stage the cancer and plan treatment. This careful process ensures an accurate diagnosis, which is the foundation for effective management. Remember, always consult your healthcare provider for personalized advice and guidance.